Hello, everybody. Can you guys all hear me? I want to thank you all again. Let me just turn this off. Hello, everybody. Can you guys all hear me? I want to thank you all again. Let me just get this quickly turned off, and we will get started. Okay. I just want to thank you guys all for joining, and I wanted to give a couple of quick updates on things that have been going on. And there's been major advances in terms of things that we know about the coronavirus. And then I want to get to talk about a little bit about what Dr. Fauci said about the Remdesivir's clinical trials, and he thinks there's a lot of promise. But if you look at the actual data, which I will share with you guys, you'll see that it's actually a bust. So those of us in the community don't know exactly what he's talking about when he's making these announcements. So before doing that, I just wanted to share a couple of things. You guys have all seen me being with a shirt or a t-shirt, but today I'm wearing a hoodie. And the reason I'm wearing a hoodie is because my good friend Olga sent me this awesome hoodie, and I'll show you guys what it says on top on there. It says, "Let's quarantine and chill," right? So I want to thank Olga for this awesome hoodie. Very pertinent for these situations that we're going through. So hopefully we can all chill and quarantine and until the right time to open up. I will take some comments or questions when the time is right, but I want to get started and talk about some of the data. And the major topics I want to cover today is the statistics coming out of Sweden, because most of you guys have been talking about Sweden and how Sweden is not doing quarantine, but the numbers are great. So I want to show you guys the numbers that have come out and discuss about that. The next thing I want to talk about are strokes. We're starting to see strokes in the young population. We're talking about 20, 30-year-olds, right, that are coming in with strokes. So I want to be able to discuss about this and tell you guys a little bit about what we're learning. The other thing is Remdesivir clinical trial I want to go into. And lastly, and again, if you are a parent, please don't panic, but there's been kids showing up very young age with hyperinflammatory like illness, which is resembling a little bit like Kawasaki disease. And Kawasaki is a general systemic blood vessel inflammation. So I want to quickly touch upon that, unless you, just in case you guys have heard it on the news. I want to make sure that you guys know what it is and whether you should worry or what you should do, right? So let's get started with today's topics, and then I'll go through everything that I want to talk about and take some questions at the end if there are any. Okay, so let's take a look at the numbers coming out of Sweden, right? And a lot of people have been talking about Sweden. Hey, they've been saying Sweden is doing great. They haven't done quarantine, but if you look at their numbers, they're doing a lot better than or equal to some of the countries that did do quarantine shutdown, right? So let's take a look at this data that's I got today, and the numbers are based out of the CDC numbers. So here we're looking at the total confirmed COVID-19 deaths, and it's normalized per million people. In other words, it's normalized to the total population of the country, right? Because that's the fair thing to do. Some countries have more people than others, so you don't want to count number of deaths only, because if some country has more population, then of course they're going to have more deaths. So this is comparing essentially the Scandinavian countries, right? We have here Sweden, Denmark, Norway, and Finland. And the reason I looked at only the Scandinavian countries is because out of these Scandinavian countries, only Norway did very limited social distancing, no quarantine for the most part. And whereas the other countries did social distancing and quarantine like we're doing in the United States. And it's good to compare these countries because they're right next to each other. So in terms of geographical location, the overall society, in terms of their healthcare system, it's very similar, right? So the only thing different between these countries is that Sweden was the only one that decided to go with the, let's just call it, herd immunity approach, and the other countries decided to do quarantine. So let's take a look at the numbers. This is the death rate, or the number of deaths per million between their first onset of the first time they saw the first case of death, essentially beginning March, sometimes March, and this is updated until today, like 5 o'clock Europe time, right? So what are we seeing here? What we see is that the other Scandinavian countries, Denmark, Norway, and Finland, have essentially stabilized, right? They're kind of plateauing, although Denmark is a little bit worse than the other two. But if we look at Sweden here in orange, it looks like Sweden seemed like it was doing as good or as well compared to the other countries. And then, boom, it started to essentially increase. So whether they'll stabilize eventually, right now it looks like Sweden is doing worse and has a poorer outcome compared to the other Scandinavian countries, right? And again, they did not do social distancing. So it is possible that maybe the other countries will also start to increase. But we don't know that. But for the time being, this is what the data is showing. Even if Sweden stabilizes in a couple of weeks, right, they're going to stabilize at a much higher death rate number. In other words, even if they get to herd immunity, which is the number of people you need in the population, if you don't have a vaccine, the number of people in the population that must be infected and recovered in order for the whole population to be protected, right? So in this case, you need about 80 to 90% of the population. So Sweden might get there a lot faster than other countries, but at the same time, they're going to end up having more deaths if you look within the population, right? So reaching that number faster will get you there faster and maybe open up the economy faster, but you're going to have to sacrifice a lot more people in the country. So that might be the trade-off, that certain countries are not willing to do that. So I'll continue updating you guys on what's going on with Sweden and the Scandinavian countries to kind of trace the overall path. And again, just to iterate for those that are just joining or don't know what Sweden is doing, Sweden said we're going to try to reach herd immunity really quick, or we're going to reach herd immunity. And what that means is we're going to have all of our population essentially not on lockdown, no quarantine, and allow them to get the infection, and whatever happens. And we have a good healthcare system, so our hospital systems are going to be able to absorb that, right? And so they went the risky route and decided not to do any kind of social distancing, whereas the other countries did the lockdown, social distancing, and the strict measures that we're also seeing in the United States. And here we could see that there's a major difference in terms of deaths within the country in these Scandinavian countries. We'll see how these numbers hold up in the next coming weeks, and I'll update you guys on that soon. All right. So that's the first thing I wanted to talk about. The next thing I wanted to bring up is essentially the Remdesivir clinical trial, right? And let me switch screens to that. Okay, so what is going on here, right? So most of you guys have probably heard Dr. Fauci yesterday, and it's been all over the news that they did a double-blind, randomized, multi-center clinical trial, which is the gold standard of all clinical trials that you could do. And this is the first full trial on any medication done for COVID-19, right? And what they were saying, and Dr. Fauci saying this is going to become the drug of choice, and this will be essentially the standard of care, and they're pushing the FDA to essentially they're pushing the FDA to approve of this drug, right? So initially you're thinking, great, we have a drug and they're doing double-blind, randomized, multi-center clinical trial. Just to kind of describe what that means. Randomized means we're going to take patients, we're going to separate them into two groups. One group will get the drug and one group will get the placebo. In this case, the placebo is essentially the standard of care. Everything that you would do with the patient except not give them the drug. In this case, the Remdesivir, right? Multi-center, which means you're going to have multi different hospitals involved, so you're going to essentially decrease the randomness. And it's double blind, meaning the physician who's treating the patient doesn't know if the patient is getting the drug or the placebo. The patient doesn't know whether they're getting the drug or the placebo, right? So this is the most perfect kind of clinical trial you could do to get rid of any kind of placebo effect. And this is coming out of China, and so people were excited, and again, Dr. Fauci kept saying this that this is going to be a drug of choice. In fact, this wasn't the only paper. There were two other studies that came out yesterday, today, and based on these, Dr. Fauci said this is going to be the drug of choice and the standard of care. Well, let's take a look at the results that they got, right? So first of all, if we read what they're actually doing, they took about 158 patients who got the medication, and then they have about 79 who got the placebo. If we look at the results of this study, what we're seeing is that this is the conclusion and the results that they're claiming, right? In this study, and I'm reiterating and reading exactly word by word the study results, and this was published in Lancet, which is the one of the top journals in medicine, right? So here are the results. The results say, in this study of adult patients admitted to hospital for severe COVID-19, remdesivir was not associated with statistical significant clinical benefits. However, numerical reduction in time to clinical improvement in these treated patients required earlier confirmation in larger studies. So what they're saying is that essentially we saw no effect on overall survival. People that got the drug versus not, there was no difference in survival. The only thing that they saw was that the patients who got the medication just went home 5 days sooner, right? 5 days earlier compared to those that did not. But in terms of overall survival, there was no benefit, right? And so this was kind of, we weren't sure exactly where the excitement was in all of this, right? So if we look at the rest of the data in this paper, and this is actually the word by word verbatim, I'm reading the actual words of the author, and they're saying that no statistically significant benefit were observed for remdesivir treatment beyond those of standard of care, right? The clinical trial did not show any improvements in overall survival. The only thing that they saw was a slight rapid improvement and going home, but it doesn't mean you're going to survive more, right? Those people that did well and survived, they just went home 5 days sooner. But those that ended up dying, there was no difference, right? And moreover, they had, if we look at the adverse effects, which means the side effects of the drug had way more side effects compared to the placebo. So they were essentially forced to stop the drug because they saw no benefit. And not only did they not see benefit, they had increased side effects. So they said we might as well stop the drug, right? So this is the paper that came out of China just yesterday. Now let's take a look at the other study that Dr. Fauci kept saying yesterday during the conference, and it's been all over the Twitter world and social media, was the study done here in the United States, the NIH clinical trial, right? Even if we look at the title of this, and I got this literally from the NIH website, which is the National Institute of Health, right? That's running this clinical trial. I got this literally a screenshot from their page. The title says NIH clinical trial shows Remdesivir accelerates recovery from advanced COVID-19 patients. When you read that, you're going to say, Jack, the drug is working. Let's read exactly what the results showed, right? So let's take a look at what the results showed, right? Let's read it. Again, this is directly from the page. It says preliminary results indicate that patients who received the drug had 31% faster time to recovery than those who received placebo. Just like the Chinese study, they had a little bit faster recovery. Specifically, the median recovery was 11 days compared to 15 days for those who did not. So they saw a 4-day difference. And let's read the final line. Results also suggested a survival benefit with a mortality rate of 8% versus 11%. You're like, huh, it's saying that there's a difference. But then they show you that the statistical p-value, which tells you if your finding is actually significant, it's 0.059, 0.06 essentially. For those of you who have any kind of background in statistics or any kind of mathematical background, knows that in order for a study to be significant, it has to be 0.05 or less. In other words, the slight difference that they saw in survival, which was insignificant, was also statistically insignificant. In other words, this could happen by chance. So we have here 2 studies showing no difference in survival benefit, right? So those who recover just happen to recover a little bit faster. Is that clinically important? Not really. And then there was a 3rd study that was done, which I didn't get a chance to incorporate because the data isn't published. It's just briefings and summaries that have come out, which essentially show the same thing. So 3 studies, randomized controlled clinical trials, so far show no benefits of this drug in terms of mortality. So this is why I want you guys to be extra careful when you see stuff essentially described on the news that it's a miracle drug. This is going to be the drug of choice. This is going to be the standard of care. Well, you got to look at the data, and the medical community is kind of confused why the head of the task force and the head of the National Institute of Allergies is saying that the remdesivir is the drug, because the data itself is showing that it's a complete flaw. And just to kind of sidetrack, I think even in the case of a pandemic, we must not move away from science that has guided us, because we cannot loosen our we cannot loosen the strictness of science to give us true answers just because we're in a pandemic, because we don't want to start chasing down a rabbit hole after stuff that is not going to work. We must stick to our principles that have guided us in terms of doing the right science the right way to make sure that the results we get, we can trust. Therefore, we need to make sure that when we look at this data, we're not just going after stuff that has no significance, either statistical or real, right? So again, I just want to caution you guys on that. So that's all I'm going to say about this this drug. The next thing I want to talk about is the increase of stroke patients that are presenting to the hospitals. And again, this seems to be in the young population, right? We're talking about 20-year-olds, 30-year-olds. Again, the number of patients that are presenting with this is not a lot. I'm not talking about hundreds and hundreds, but there's a significant population that is presenting, and they happen to be very young people. In a medical forum through Exchange, there was a case presented in which a early 20-year-old presented with essentially left-sided weakness and psoriasis, right? So these are becoming more reported, and we're not sure exactly why it's happening. And I'm going to go into it a little bit on that towards the end. But in this paper that came out in New England Journal of Medicine, they presented 5 cases in New York of patients who presented essentially with stroke as being the first sign or symptom of the disease, right? So here we could see the ages of the patients was from the youngest was 33 years old, and the oldest was 49 years old. They had 1 female and 4 male patients. And if we look at the signs and symptoms when they first presented to the hospital, well, one of them just had a cough, headache, and chills. The other one had no symptoms at all of COVID-19. The third, again, no symptoms. The fourth only had lethargy, which just means feeling tired and, not in the mood to do anything. And then the last one had fever, cough, and lethargy. Again, so that might had some, inkling of a COVID-19 infection. But again, all of this turned out to be COVID positive patients who ended up suffering major strokes, right? And some of them had to be discharged into either intensive care or a rehab, right? So again, we're not sure why these strokes are happening, and specifically they're happening in the younger population, and therefore we need to be careful. And I urge you guys, especially men who tend to kind of brush things off and essentially try to toughen it out. Doesn't matter your age. If you start having any signs and symptoms of stroke, right, which means if you're feeling like you have weakness on one side, you have inability to talk, you're feeling weak, all of these signs and symptoms, please do not disregard them as something and brush it off. Think about these things. And again, I'm not trying to worry or create panic in people. I'm also saying that we can't have people toughening things out and presenting to the hospital way too late. So think about these things. Again, the numbers are not very high, but you don't know what number you're going to fall into personally. So just wanted to let you guys, as my audience, kind of be aware of these things and be careful. And again, these are happening in young people, right? So just be careful, the young crowd out there. And the other thing this kind of highlights is that even though we're saying, yes, young people are going to they recover, do well, yet some of them might actually get something like this. We also don't know what the long-term consequences of this disease is, right? So even if you're young, you get the disease, you do well, what's going to be the long-term morbidity as a consequence of this, right? Are you going to have changes in your lung that are going to stay with you forever and cause long-term problems? Are you going to have changes in your blood vessel that's going to predispose you to other stuff? So those of us that are saying we got to be careful with the virus, one of the reasons is because we still don't know the long-term consequences, and we won't know for a long time. So even the young people that are saying nothing is going to happen to you, yes, it's true, nothing might happen to you right now, but we don't know the long-term consequences. So let's all be careful, right? And the last thing, again, this isn't published, but this was circulated amongst the medical community to kind of give us a heads up to watch out for things. And this was coming from England, the Pediatric Intensive Care Society from England, but there was a similar one also released from Spain. And what they were saying is that they're seeing kids who are presenting with a constellation of symptoms, right? Included included gastrointestinal problems, right? Like stomach pain, very high fever, and these abdominal signs and gastrointestinal symptoms uh, is very reminiscent of a disease called Kawasaki's disease. And Kawasaki is, just really briefly, it's a general systemic disease that infects the blood vessels and causes inflammation, and that could lead to many different issues. So everywhere you have blood vessels, if you think about it, if you have inflammation there, it's going to cause a problem, right? So these kids have very high fever. Their eyes could be really red with the blood vessels. They could have heart problems, right? So these kids that are presenting with COVID-19 positive, they look like they're presenting with similar signs to Kawasaki. And I might add that some of them are testing negative for COVID, but if you tested for the antibody, it looks like they have it. So these presentations of this Kawasaki-like hyperinflammatory disease seems to happen 10, 20 days almost after the kid potentially had the virus and got better, right? So this kind of was circulated amongst the medical community for people to kind of watch out. This was coming from England, and then this was coming from the Spanish Association of Pediatrics. And they said that most of these children have a fever, present with redness, conjunctival injection, which means redness in the eye. Um, and it was reminiscent of Kawasaki's or toxic shock syndrome, right? And that even though some of these COVID PCRs look negative, some negative PCR patients had positive antibody testing, right? So that says that they might not have the disease right now, or the virus right now, but they had it and cleared it, and now we're getting this second wave of presentation, right? So why why am I kind of telling people to be cautious about this virus? Because we're learning more and more stuff. So in the next couple of minutes, I want to kind of explain to you guys that why are we seeing these new kind of stuff popping up all over the brain now, gastrointestinal system, the inability to smell, and more kinds of symptoms are being added onto the list, right? We're learning more and more about this virus. And recently there was a paper published, a very beautiful and elegant paper, and this chart summarizes that, right? What they did was they looked for the receptor called ACE2. ACE2 is a receptor, a protein in our body that the virus uses to attach itself and enter into the cell and cause all this havoc and damage, right? So what these researchers did, they said, where in the body at different ages is ACE2 receptor expressed, and what's the consequence of a virus entering each of those cells in the body? So what they found here was, as we could see, it's obviously very highly expressed in the nasal area, and this is why the virus enters via the nasal, right? And because it has the receptor, you could latch onto it and enter into the body. And then it's in the lungs, in the gut, a lot in the heart, which could explain some of these Kawasaki-like symptoms also in the kids. It's in the eye. Moreover, in the brain, it's also expressed. This is why we're also seeing patients that look like they might have a stroke, but they might also have what's called encephalitis, which means infection in the brain, essentially. It's also expressed in the nose, the nasal area. And so this could explain why certain patients have a loss of smell and taste, right? Because these cells that are in the nose, these are the cells that the virus attacks and kills. So what we're learning is that even though initially this was called a respiratory virus because we thought it affects the lungs and our breathing system, but we're starting to see is that, yes, initially it could enter through the respiratory system, meaning when you breathe it in, but it could travel all over the body and do various things depending on what part of the body it's in, and depending on the susceptibility of that structure to a viral infection. So we're learning more and more about this, and we're looking at like mechanistically how in each tissue it might be doing something different. And the reason I'm bringing this up is, yes, we flattened the curve. Yes, we're all anxious to go out, but I think we also can't lower our guards, because we're learning new things about this virus every day, and we still don't have a good handle on it. And I think, yes, we're not going to wait till we know everything about it, but I think we need to know at least something about it before we let the population out, at least have some kind of intervention at least working. And with the flop of all these drugs, it's a little bit disheartening. All right. So this is kind of all that I wanted to talk about today, and then leave the rest up to you guys to ask questions for a little bit. So if you guys have any questions, please let me know. So I'll take a look at the list of comments and questions. So if you guys have any questions, please let me know. I'll take a look, and if not, I will kind of call it a day. I'll do this more often, but if there are any, if there are no questions, I want to wish you guys all the best, and just do the right thing, stay healthy, and again, like it says on my hoodie, remember, quarantine and chill, right? So make sure we're not dropping our guards, we're doing the right thing, and we're essentially making sure that everything we've done the last few months, we're not going to lose it by starting all this off really early, right? All right, guys, looks like I don't have any significant questions here. I'll check one last time, and if there are no questions, I will essentially call it a day, and I'll wish you guys all a wonderful day or wonderful night, depending on where you are. Stay safe, stay healthy, and I will see you guys in the future. And don't forget to hit that subscribe button so that you don't miss out on any of these talks. And if any of your friends just happen to miss this and want to see it, I will be posting this on YouTube, so you guys could share the link with everybody. All right, everybody, I want to thank you guys all, and I'll see you guys in the near future again.